Imagine a system that can spot a tumor in an MRI scan faster and more accurately than the most experienced radiologist, but also misses something subtle that could change a patient's fate. That's the reality of AI in healthcare diagnostics today. In 2023, AI-powered tools are already being used in hospitals across the U.S. to detect breast cancer from mammograms, with some models outperforming human experts in controlled studies. But while AI excels at pattern recognition, it still struggles with the nuances of real-world cases, like rare conditions, overlapping symptoms, or ambiguous imaging. This isn't just about machines versus doctors. It's about how we redefine accuracy, trust, and responsibility in medicine. How do we balance AI's incredible speed and precision with the irreplaceable human insight that often saves lives? The answers are in the data, the ethics, and the next frontier of medical science. In medical imaging, AI has proven exceptionally skilled at detecting subtle anomalies that might escape the human eye. A recent report found that AI systems can identify lung cancer in CT scans with an accuracy rate comparable to that of top radiologists, sometimes even outperforming them. Researchers at Stanford University developed an algorithm that detected breast cancer in mammograms with greater precision than 6 out of 7 human experts in a landmark study. These systems don't tire, don't rush, and can analyze thousands of images in seconds, making them invaluable in high-pressure environments like emergency rooms. Take the case of diabetic retinopathy. AI tools now screen for this condition in eye scans with 90% accuracy, a level trusted enough to be used in rural clinics where specialist care is scarce. The implications are clear. AI doesn't just assist, it enhances diagnostic reliability. As these tools evolve, they're not replacing doctors, but reshaping the landscape of early detection. In 2021, a study revealed a critical shortcoming in AI's diagnostic capabilities. When analyzing CT scans for lung nodules, the system overlooked subtle, early-stage cancer indicators that human radiologists identified. This discrepancy highlights a key limitation. AI may struggle with nuanced patterns that require contextual understanding. A narrative review on AI in medical diagnostics points out that while the technology excels in speed and pattern recognition, it can lack the interpretive depth of trained professionals. Consider another angle. AI models are only as good as the data they are trained on. If a dataset underrepresents certain conditions or demographics, the model's accuracy can suffer. Researchers emphasize that AI should complement, not replace, human expertise. A 2022 comprehensive analysis on AI in healthcare underscores the importance of integrating these tools into clinical workflows with caution. As we explore further, it becomes clear that refining these systems is essential to achieving their full potential in diagnostics. In the intricate world of diagnostics, subtlety can mean the difference between early intervention and irreversible damage. Consider breast cancer screening. AI algorithms have demonstrated the ability to detect microcalcifications as small as 0.5 millimeters, changes so minute they often escape the human eye. A recent report found that AI-enhanced imaging systems can improve early detection rates by up to 20% in some cases, potentially saving countless lives. Picture this: a lung CT scan showing a shadow barely larger than a pinhead. To a radiologist, it might be a borderline finding. But AI can cross-reference this with thousands of similar cases, identifying patterns that suggest early-stage tumors with remarkable accuracy. Researchers say these tools are not just improving diagnostic speed, but also reducing variability in interpretation. One striking case comes from a 2023 study where AI flagged a pancreatic lesion in a routine scan that was initially dismissed by human reviewers. As the field evolves, understanding these nuances becomes key to unlocking AI's full potential in medicine. In a study published in The Lancet Digital Health, researchers found that while AI systems can detect abnormalities in imaging with impressive accuracy, they often miss critical nuances when the image is ambiguous. A recent report from the American College of Radiology highlights a case where an AI flagged a lung nodule as suspicious, but the human radiologist, considering the patient's history of benign nodules and recent viral infection, correctly ruled out cancer. Human doctors don't just see the image, they see the patient. They weigh lab results, symptoms, and prior diagnoses, creating a full clinical picture that AI can't replicate. For instance, A 2022 review in Nature Medicine noted that AI models trained on imaging data alone may overlook 30% of relevant clinical context, leading to false positives or misdiagnoses. This doesn't mean AI has no place in diagnostics, it does, but it underscores the irreplaceable value of human expertise in interpreting uncertainty. As we look closer at how AI and doctors can collaborate, the next step is clear. AI's effectiveness in diagnostics hinges on the data it learns from. But real-world patient variation often outpaces the datasets used to train these models. A recent report found that AI systems trained predominantly on data from high-income countries struggle to diagnose conditions in low-resource settings, where disease patterns and imaging quality differ significantly. Researchers say this disparity can lead to misdiagnoses, especially in regions with limited access to standardized medical imaging. Take skin cancer detection. One study revealed that AI models trained mostly on light-skinned patients had reduced accuracy when applied to darker skin tones. This isn't just a technical shortcoming, it's a public health issue. As AI becomes more integrated into clinical workflows, the need for diverse, representative training data grows urgent. Without it, the promise of AI in healthcare remains incomplete. But how do we expand these datasets responsibly? That question leads us to the next challenge. In 2020, a pivotal study revealed a critical limitation in AI's diagnostic capabilities. Researchers found that AI models trained on mammograms often missed subtle cancer signs in dense breast tissue, something human radiologists could identify. This highlights a key challenge. While AI can process vast data quickly, it sometimes lacks the nuanced judgment required for complex cases. Another study emphasized that AI tools, though promising, are not infallible. When tested alongside human experts, AI models performed well in general cases, but faltered in high-risk or ambiguous scenarios. Consider breast cancer screening. AI can flag anomalies efficiently, but dense tissue remains a tricky frontier. This isn't to dismiss AI's value, its role in triaging cases and reducing workload is undeniable, but it underscores the need for collaboration between human expertise and machine precision. As AI continues to evolve, refining these models to match the subtlety of human insight will be essential. The next step? Ensuring AI complements, rather than replaces, the diagnostic process. One of the most pressing challenges in AI diagnostics is the so-called black box problem. Unlike a human radiologist, AI systems often can't explain how they arrive at a conclusion. A recent report found that in some cases, AI tools used in medical imaging failed to detect subtle signs of early-stage lung cancer, yet offered no insight into why the error occurred. This lack of transparency can erode trust, especially when a misdiagnosis has life-or-death consequences. Consider a case in which an AI flagged a skin lesion as benign, only for a dermatologist to later identify it as melanoma. Without understanding the model's reasoning, clinicians are left in the dark about whether to override the AI's judgment. Researchers say this opacity hampers adoption in high-stakes fields like oncology. The challenge now is to develop AI systems that are not only accurate, but also interpretable. Understanding how these models think is key to ensuring they complement, rather than compromise, patient care. In 2022, a pivotal study revealed that AI models lacking patient context had a 12% higher error rate in diagnosing neurological conditions. This highlights a crucial truth. Effective diagnosis isn't just about symptoms, but the full story behind them. A narrative review published in 2023 emphasized that AI's success in diagnostics hinges on integrating rich, contextual data, such as patient history, lifestyle, and environmental factors. Consider a case where an AI flagged a brain lesion as non-cancerous, missing subtle indicators that a human doctor later recognized due to the patient's unique medical history. Researchers say this underscores a key limitation of AI when it operates in isolation from the broader clinical picture. Another report noted that AI tools trained with comprehensive datasets, including socioeconomic and genetic information, show up to 20% greater accuracy in early disease detection. The takeaway? Context isn't just helpful, it's essential. As AI evolves, pairing it with human insight ensures diagnoses are not just fast, but truly accurate. This balance sets the stage for smarter, more holistic healthcare. In clinical trials, AI is reshaping how patients are selected. A recent report found that machine learning models can analyze vast datasets to identify suitable candidates up to 30% faster than traditional methods. This acceleration is critical in trials where time is a limiting factor. However, subtle differences in patient profiles, like genetic variations or comorbid conditions, can still lead to misclassification. Researchers say these errors may skew trial outcomes, undermining the very precision AI aims to deliver. Take oncology trials. AI tools trained on imaging data can miss rare tumor subtypes if not exposed to diverse datasets. This highlights a broader challenge: data diversity. One striking case involved a heart disease trial where an AI model excluded patients with uncommon arrhythmias simply because they were underrepresented in the training data. While AI streamlines enrollment, it also reveals gaps in how we collect and use health data. As we refine these systems, the next step lies in ensuring they reflect the full spectrum of human health. In certain hospitals, AI is being employed not as a replacement, but as a second opinion, yet only when it identifies clear, obvious issues. A recent report found that in radiology departments, AI systems are most effective when flagging unmistakable anomalies, such as large tumors or fractures. However, they often miss subtle patterns that require human intuition and experience. Researchers say that while AI can process vast amounts of data faster than any human, it still lacks the contextual understanding that trained clinicians bring to the table. Take, for instance, a case where an AI flagged a prominent lung nodule in a CT scan, prompting doctors to act swiftly, yet overlooked a less obvious early-stage abnormality nearby. This human-AI collaboration model is designed to enhance diagnostic accuracy, not replace it. As AI continues to evolve, the key lies in refining its ability to detect nuance. But for now, the most successful outcomes come from pairing machine precision with human insight. As we move forward, the next challenge is not just improving AI, but integrating it seamlessly into clinical workflows. The fusion of AI with broader patient datasets is one of the most exciting frontiers in diagnostics. A recent report found that integrating electronic health records, genetic profiles, and real-time biometric data can improve diagnostic accuracy by up to 30% in complex cases. Researchers at Stanford are already testing AI models that analyze decades of patient history alongside current symptoms to predict conditions like sepsis hours before they manifest. Yet, even with these advances, subtle diagnostic nuances remain a hurdle. AI excels at patterns, but struggles with context, like a patient's unique medical history or environmental factors. For instance, a machine may flag a symptom as common to one condition, while a human might recognize it as a rare side effect of a medication. These gaps highlight the need for collaboration between AI and clinicians. As systems evolve, the goal isn't to replace doctors, but to augment their decision-making. Let's look at how this partnership might shape the next decade of medicine. AI is a powerful tool, but it's not infallible. A recent report found that while AI systems can detect abnormalities in medical imaging with impressive speed, they occasionally misinterpret rare or atypical cases. In one study, an AI model flagged only 85% of lung cancer cases correctly, underscoring the need for human oversight. Take the case of a 2021 trial in breast cancer screening. AI improved detection rates, but still required radiologists to review results and catch subtle nuances the system missed. The real strength lies in collaboration. AI handles high-volume data with speed, while doctors apply clinical judgment and patient history. Researchers say this hybrid approach reduces diagnostic errors by up to 30% in complex cases. AI isn't here to replace physicians, it's here to augment them. As we look ahead, the next step is ensuring this partnership remains balanced, ethical, and focused on the patient. AI in diagnostics is evolving at an astonishing pace, but understanding its limits is just as vital as recognizing its promise. A recent report found that AI systems can now detect diabetic retinopathy with an accuracy rivaling that of trained ophthalmologists, yet these tools still struggle when data is incomplete or biased. Consider a 2023 study showing that AI models trained primarily on data from one demographic often underperform when applied to diverse patient groups. This highlights a key challenge. AI is only as unbiased as the data it's fed. While AI can analyze thousands of scans in seconds, it lacks the human intuition to weigh a patient's full medical history or subtle symptoms. The future of diagnostics won't be AI versus doctors, but AI with doctors. If you're as curious about AI's role in medicine as we are, hit that subscribe button and let us know in the comments what you'd like to explore next. Sources for this video are all in the description.